Hello everyone, my name is Ellen Chuckingle, and today I will be reviewing procedures for Expedited Partnered Therapy Prescriptions, or EPT, as I will refer to it from now on. My objective today is to describe prescribing components of the new UIC protocol for Expedited Partnered Therapy. We are in the process of approving a protocol for dispensing medications for EPT, and therefore the purpose of my presentation is to ensure prescribers understand the process for prescribing medications for EPT and also understand the procedure the pharmacy will follow when dispensing the prescriptions. To begin, what are Expedited Partnered Therapy prescriptions? Illinois law permits designated healthcare professionals to prescribe prescription antibiotics to the partners of patients diagnosed with chlamydia and/or gonorrhea with no physical exam of the partner. Healthcare professionals include licensed physicians, physician's assistants, and advanced practice nurses. EPT applies to any partners of an infected patient within the last 60 days or the most recent partner if no partners within the last 60 days. The law does not limit how many partners may be treated through EPT. And who is the ideal candidate for EPT? Because we know the most ideal situation would be for any potentially infected partner to be examined by a healthcare provider before receiving any treatment. However, this does not always happen, and these would be patients who are candidates for EPT. So if the partners of patients infected with chlamydia and/or gonorrhea are unable or unlikely to seek prompt clinical services, and this could be for any reason such as if they do not have medical insurance or have transportation difficulties, then they are ideal candidates for EPT. The clinician should still attempt to motivate patients to refer their partners to healthcare providers, especially for treatment of STDs, testing for HIV and pregnancy, or if the partner has signs and symptoms of a systemic infection. The patient should have laboratory confirmation of diagnoses of chlamydia or gonorrhea before prescribing EPT for the partner. EPT without laboratory confirmation should only be considered with a high clinical suspicion for gonorrhea or chlamydia in the index case and concern about loss of follow-up in the initial patient. And as we all may know, the standard treatment for chlamydia is azithromycin, and for gonorrhea it is azithromycin plus ceftriaxone IM injection. And our goal is for all patients to receive this therapy if infected with gonorrhea and/or chlamydia. However, if you feel that a patient's partner will not go to see a healthcare provider to receive prescriptions and testing for gonorrhea or chlamydia and receive a prescription for ceftriaxone and azithromycin, then it is better for them to receive prescriptions through the EPT protocol than no treatment at all. So when treating the partners of infected patients with EPT, you would still order azithromycin for chlamydia, but for gonorrhea you will order cefixime 400 milligrams orally instead of ceftriaxone IM. It is important to note that oral cephalosporins are less effective in eradicating pharyngeal gonorrheal infections. So if there is a concern for pharyngeal infections, for example, if the partner has been exposed to a male urethral infection at this site, then the healthcare provider should discuss this with the patient and indicate that oral treatment may not cure pharyngeal gonorrhea, and further insist that the partner should still seek care. When sending prescriptions for EPT, this is what is required to be on the prescription based on our new protocol. So the providers must indicate that the prescription is for EPT, the diagnoses and the partner's medication quantity, all under special instructions. All other elements required for a prescription will be required before the medication is dispensed. So if your patient is not able to tell you their partner's name, date of birth, or allergies, that is okay, but they will need to provide that information before the medication can be dispensed at the pharmacy. Also, if the partner has prescription insurance, then the medication can be run through their insurance. However, if they do not, then they will have to pay cash price. At our Wood Street Pharmacy, the cash price is about $32 for azithromycin and $60 for both azithromycin and cefixime. This slide depicts the minimum information needed when sending prescriptions for EPT. The information on the top is what is specifically required for the patient. The information under special instructions is what is specifically for the partner or partners if there are multiple. Once again, you must indicate that it is for EPT, the diagnoses, and the quantity of medication needed for the partners. This slide depicts additional information you could include if it is available, which include the partner's name, date of birth, and any known allergies. But once again, if you do not provide this information, the pharmacy must obtain it before dispensing. And this information I am providing is for the protocol for our UIC pharmacies. If these prescriptions are sent to other pharmacies, I am not sure what their procedure is, and they may call you to clarify. And once again, the information for the partners must be under special instructions. It should not be put under prescription notes to the pharmacy. And according to Illinois law, healthcare professionals must provide patients infected with chlamydia and/or gonorrhea and their partners who will receive EPT counseling and written materials. This education should include warning about administering EPT to pregnant partners, and highly encourage all pregnant partners are examined by a healthcare provider, information about the antibiotics prescribed, including dosing and side effects, information about the treatment and prevention of STDs, requirement of abstinence for 7 days after treatment, notification of the importance of sex partners to receive testing for HIV and other STDs, and the importance of examination and treatment for any partners, and also notification of the risk to self, others, and the public health if the STD is not completely treated. And Illinois EPT legislation protects healthcare providers providing EPT without fee or compensation from civil and professional liability. So as long as the healthcare provider provides the patient with counseling and written materials to give their partner, there are no liability concerns. And this concludes my presentation on expedited partner therapy. Thank you for your attention.